Have you ever felt a little run down, like your body isn't quite fighting things off the way it usually does? It's a common feeling, especially when dealing with health challenges. We all want our bodies to be strong defenders, ready to tackle whatever comes our way. Yes, absolutely. A low white blood cell count significantly increases your risk of infection. These essential cells are a crucial part of your immune system, acting as your body's frontline defenders against harmful bacteria, viruses, and fungi. When their numbers drop, your ability to fight off these invaders is severely compromised. To understand why, let's talk about white blood cells, also known as leukocytes. They are made in your bone marrow and circulate throughout your bloodstream, constantly monitoring for threats. The most important type of white blood cell for fighting bacterial and fungal infections is called a neutrophil. When you have a low count of these neutrophils, a condition known as neutropenia, your body becomes much more vulnerable. Many medical treatments, especially chemotherapy for cancer, work by attacking rapidly dividing cells. Unfortunately, this includes the rapidly dividing cells in your bone marrow that produce white blood cells. This temporarily reduces your body's ability to produce new defenders, leaving you with fewer soldiers to protect against germs that are always around us. The severity of the increased risk directly correlates with how low your neutrophil count drops and for how long it stays low. So, what can you do to reduce this risk? The good news is there are several proactive steps you can take. First and foremost, meticulous hand hygiene is incredibly effective. Wash your hands frequently with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer if soap and water are not available. Try to avoid crowded places and close contact with anyone who appears to be sick. This includes friends and family who might have a common cold. Be diligent about food safety, washing fruits and vegetables thoroughly and cooking all meats to their proper temperatures. Your care team will also advise you on specific precautions, which might include avoiding certain activities or foods, and they may prescribe medications to help boost your white blood cell production or prevent infections. It is also vital to know about something called neutropenic fever. This is when a person with a low neutrophil count develops a fever, and it is a medical emergency that requires immediate attention. A fever in this situation is often the only sign of a serious infection because your body cannot mount a full inflammatory response without enough white blood cells. Your medical team will instruct you on what temperature constitutes a fever for you and what to do if you experience one. Being aware of these specific signs and acting quickly can make a huge difference in managing potential infections. Understanding the connection between low white blood cells and infection risk empowers you to take control of your health during challenging times. By being proactive with hygiene, avoiding exposure, and staying in close communication with your healthcare team, you are actively protecting your body. This knowledge allows you to navigate your treatment journey with greater confidence and well-being, keeping you safer and stronger.